So today I'm wearing a shirt that embodies the energy that if some cats had opposable thumbs and the ability to write, this is what they would write when facing liver disease. This is the energy they've got to bring to the table. A couple of nerdy footnotes about livers. Well, what is a liver anyways? Well, did you know the word liver comes from the English word lifer, and lifer meaning associated with life? For a long time, we've known the liver is one of those essential organs. You eat food, it goes down the esophagus, into the stomach, it's digested, it goes into the small intestines, you're going to pick it up internally into your body. Think of the liver like a factory, okay? It's got to take in all this food, all these nutrients, it's got to repackage, it's got to throw some stuff in waste there, detoxify this over here, repackage and get things moving out towards the body. It's kind of like Amazon Prime if Amazon was run by Walter White from Breaking Bad, so you had a chemical factory that had to repackage and move everything out everywhere. It's like that, it's a hybrid between those two. Cats have livers just like people have livers, and it's different in ways that tells us why they sometimes get in trouble with liver illnesses or liver disease or liver inflammation. Because they're carnivores. Cats evolved to eat meat. Rodents, they're hunters. If they've ever swatted you lovingly in the face or on the back for food, you know this already. If they've ever played a little bit too hard or hunted you down in your house, they're hunters. You know this. Their liver is highly adapted to that task. Unlike people, people are omnivores. And so with cats, basically, if there's any situation, either primarily due to the liver or secondarily that's cutting down their calories, basically the cat liver wasn't that well designed in the first place to deal with variability in the amount of calories coming in. If there's anything going on illness-wise in their body that just kind of shuts down their appetite, that variability in calories coming in can result in issues with their liver. Let me tell you a story. So I met this cat named Kylo, and Kylo is a remarkable cat. He's this huge black panther. Liver diseases are just so variable, right? You get the blood work back initially, there's a problem with the liver, but we can't tell you exactly what the issue is with the liver. And then sometimes, like in Kylo's case, well, sometimes maybe we find something on an x-ray or on physical exam to say, well, maybe this isn't that good. We don't see this going well. Kylo got a recommendation for euthanasia. Now, whenever a vet says that, or says this is serious, or the prognosis is moderate to grave, something along those lines, you're gonna be really worried, right? But Kylo's owners had this spirit in this shirt to say, you know what? I don't think he's done. And so she brought him back home, thought about it, and then called us over for a second opinion. I'm a mobile vet, and so it's less stressful for Kylo for me to come over to give that second opinion, because for a lot of cats, they just prefer not to go into the plastic box of doom and then go into the clinic. They want to be at home. So here we are, and we're talking about Kylo. I'm looking at Kylo, he's looking at me, and then in comes Daddy. And Kylo, he can pick up Kylo, and then Kylo just gives him a hug around the shoulders and looks like a gigantic Black Panther big baby. And I'm looking at that and I'm like, okay, you know what? This cat's not done. This cat is like, someone help me. Someone help me out. Tell me what's up and let me decide if I've got more gas in the tank, you know, give me some autonomy over my own life. So my first thing for Kylo was, I'm there for a second opinion, but I'm gonna get me as the vet a second opinion as well. So I took Kylo's x-rays, because I'm always the optimist. And you know, there was talk about a mass, something growing inside of Kylo. I couldn't really feel it with my hands, but Kylo wasn't a fan of that anyways. So we took the x-ray and I sent it off for a radiology report. I love doing this. It's a basic thing that isn't stressful for a pet, and I get a radiologist to read it, because these radiologists, it's what they do. I can only imagine they're in some dark room somewhere, like the old-time photographers in the dark room, and they're not seeing the light of day for hours a day, and they're just reading hundreds of x-rays. And so they're really good. They've seen it all different pets, all different sizes, so they can be quite accurate and write me a report of which I can properly give an opinion. So I did that. And what did we find? a mass. There's something on the liver. Now you might think at that point, if we have a liver issue. And a liver is an organ in your body that's got a lot to do with a lot to do. It's got many different functions. So if your liver isn't doing well, it can be quite serious. The rest of the x-ray looked okay. The rest of his blood work looked okay. The rest of his exam looked okay. He was losing some weight, but seemed otherwise okay. So the whole idea was, well, is there anything we can do? This is when another diagnostic step made sense. When you have a fork in the road and you can think, does this test give me other information of which I might act upon? It's not just academic at that point. You can really derive something meaningful for having your pet go through this extra step. So we had that done, right? And lo and behold, they found this little cyst. They drained it and Kylo instantly started to look better. They also did a fine needle aspirate and they did find some cancerous cells in there. So obviously this is not a diagnosis that we prefer, but then let's look at Kylo. Look at this guy with his bowl cut. He's got right now what I call the ultrasound bowl cut. Because all vets, when we go to vet school, listen, we're beauty school dropouts, go back to high school. But look at him. He's playing, he's maintaining his weight. He's got a management plan in place. And for Kylo's purposes, that was him putting up his dukes saying, I'm not done yet. I'm still on this earth. Give me hugs. And he's not suffering, he's not in pain, and he's doing well. And what Kylo really told us is, guys, don't give up. Now let's talk about your cat. You might have some routine blood work, or your cat might have a problem. You go in for blood work and all of a sudden you find there's elevated liver values, or we call them liver enzymes, or we can call it hepatitis. Sometimes that's just the smoke alarm. The liver's just reacting to something else in the body, whether it be hyperthyroidism, whether it be other endocrine, this is hormones changing in the body, whether it be the gut being inflamed, the pancreas being inflamed. So sometimes the liver is the smoke alarm. Sometimes the liver is not. Sometimes the liver is the actual problem. How do you figure that out? Well, us vets, we have this little algorithm. Here, I'm gonna post it here right now. Right here. I'll put it right here. All right, so this is like a typical algorithm chart. It's not followed exactly like this all the time, but it is useful to go over, especially if your cat has been diagnosed with abnormal or elevated liver enzymes. Depending on your blood work, you could see ALT, ALP, GGT, AST. You don't have to worry about what those things mean in particular. Just know that if a couple of them go up, especially at high levels, it's a discussion. So 2 basic camps. We've got the smoke alarm camp, which is no clinical signs. Well, no clinical signs means other than the blood work showing this going on, your cat looks okay. So what did we talk about there? Well, investigate for non-hepatic disease and drugs as cause. What does that mean? Well, the cat liver can be sensitive to certain medications, and so we're gonna look there. The second thing is non-hepatic disease. What does that mean? Well, it's typically if you're hyperthyroid, there's other endocrine conditions that can cause these levels to go up. So it's the smoke alarm. The liver levels are high, but it is in response to something else. And when you fix that something else, we expect the liver to get better. Sometimes by itself, sometimes with a little bit of support. So that is true for many of you out there with cats with elevated liver values. Sometimes we don't find other causes, but just like we talked about earlier, the liver has a lot of jobs to do and things always happen in real time. Blood work is a snapshot in time. So what if the liver was dealing with something transient? You see the collateral, the after effects, but the thing that caused it is done. That's when we go, again, on the smoke alarm side of the page, which is no clinical signs, where you can consider trial therapy. This is typically antioxidants, liver supports, or antibiotics. This is especially true if the liver was, again, ticked off because of some other thing. Maybe the gut is inflamed, maybe we have a case of pancreatitis, also called triaditis, when all these organs are upset. You may hear these terms. Then if your cat, again, is doing well, responding to medications or treatments or supplements, you recheck these enzymes, and lo and behold, if we're normal, end of story. We're typically looking good. We maybe recheck the blood work later on. If these enzymes are still abnormal in the blood work, a typical test is bile acids. We don't always do that. So again, we don't always follow this chart this way. Sometimes, depending on how your cat looks, we are going straight to an
radiograph or an ultrasound cytology sort of thing. In addition to that, if you look at the right side of this chart, clinical signs. Now, this is different. Let's say your cat comes into the clinic. There's a motivation to check their blood because something is going on. They look sick, they're losing weight, their appetite is not there, they're vomiting, they're dehydrated, whatever it is. We're going to work up that liver sooner than later. And so this is when we're going to do some imaging, ultrasounds, cytology, that sort of thing for a lot of cats. Now for cats where for whatever reason we don't go down that path, we're definitely using our best educated guesses to provide treatment. So that's basically how your vet's going to look at liver elevations on the blood work, and it's how you can too.
This leads me to another part of our story today. I got a message from someone in New York, and this is what they said. They said, okay, it would be helpful if I have it here. Let me have a look. Your book on CKD was my Bible for fighting for my senior cat's life. I sent copies to his vets who were always on the same page, literally as well as figuratively. Thank you for helping me keep somewhat sane. So this is my CKD book. It's something that I wrote in the winter months last year. Very relevant for a condition that affects 50% of cats above the age of 12, 13. You know, we'll see it. He was 19.5 years old when we lost the battle 8 months after his diagnosis. This is a illness that, much like liver disease, sometimes you don't know it's there until it's there. It can sneak up on you. And so having a roadmap, knowing what to do, really gives confidence. That book is a roadmap. It is pew pew energy when you need it. Note now, my other cat is having liver issues. Have you written or can you recommend a good resource? Last week, the lab work came back with high numbers for her liver. Yesterday, we did ultrasound and liver aspiration. The preliminary report showed signs of fatty liver, no cancer. Still waiting for full results of liver ultrasound and aspiration. Okay, so what we're gonna do is we're gonna talk about fatty liver. Now listen, people get this as well. You can go in through an ultrasound. Maybe, you know, your weight had changed over time. Maybe you had some other condition happening and you get an ultrasound and your liver comes back as elevated fat. It happened to me. I mean, years ago, I went through this horrible divorce. I gained a bunch of weight. I went in for an ultrasound and was right in there. And so that was a huge shift for me to change my health because pew, 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 pew. So I reversed mine, no problems. Now what about for kitty cats? So what is fatty liver? What is that anyways? There can be a number of underlying causes, but very commonly, if anything causes them to unexpectedly lose too much weight too fast, they go on a hunger strike, if their pancreas hurts and they stop eating, lots of vomiting, if they get stressed out and stop eating, whatever it is, a lot of their body fat gets mobilized, goes to the liver, and the liver gets overwhelmed. And in that process of the liver getting overwhelmed, it gets clogged up and inflamed. It can make them feel very sick. Very often, I will tell people, regardless of what their cat's underlying issue is, if I don't support appetite as numero number one of the plan, including CKD, the liver can just decide to crash the whole party and all of a sudden you have a whole separate problem. And so we treat this semi-frequently. Treatment can be successful, but there are some caveats to it, right? It's not easy. It's absolutely not easy to do it. There are challenges. All right, so we have 3 lessons of what to do when your cat is facing some sort of liver disease. Step number 1, do not give up too early. We want to, just like with Kylo, we say the words, Ohana, what does that mean? It means just like Lilo and Stitch, nobody gets left behind. Friend, if you're trying, we're pulling on the rope, we're trying with you, right? So that's that first thing. You got to bring that to the table. Let's fight for it together. Thing number 2, don't miss the basics, especially at home. Often these cats need a long time to recover, so a lot of the recovery and treatments can be done at home. So this could mean for your cat learning how to do anti-nausea treatments, whether that be oral medications or by injections. This could mean making sure they're well hydrated. Sometimes it's fine with sub-Q fluids. Definitely one of the top treatments for hepatic lipidosis or fatty liver is aggressive food therapy. What does that mean? That means you got to feed them the right caloric amount, and you've got to build to that over time. Now, for many cats, this can mean insertion of an esophageal feeding tube. This is legit, and I've done it many times. I have a blog post called Pina and the E-tube. I'm gonna list it at the bottom of this post, and it describes what that process is like. And a feeding tube is not for everyone, not for every cat. You don't necessarily have to do it to have success, but it does increase those chances because you can get in the nutrition, the medication, and if there's nothing else untowards going on in the body, you can win. You can help your cat. They just look funny, they're walking around with an E-tube, but let me tell you, your house becomes a hospital ward. It is a full-time job. It is not easy. I don't shy away from saying that. I would really want people to go into that eyes wide open. The amount of work that it takes and the complications, and they have to go under an anesthetic to get this particular tube in. The tubes can clog, so it's not perfect. I've done it many times successfully. Okay, but let's say you're not doing that and you're doing all the treatment at home. Food in a syringe that you're squishing down the mouth, it's usually gonna be hypoallergenic or a low reactivity food, highly digestible, lots of calories and a small amount of volume. No easy task to try to syringe feed a cat. So we've got to get the nutrition appropriate for them for sure. That's if they go into malnutrition, it doesn't work out. It's actually the opposite of what the liver needs at this point. Food is the treatment. Vitamin B12 is a simple no-brainer. Whether you're using a product called cobalamin, which is a chew tab, it gets in the right dose every single day, it's not aversive to them, or you do an injectable once a week subcutaneously, or if they have a feeding tube, you're crushing it and you're putting it in the food, that's also a valid way to do that. So that's a no-brainer, vitamin B12. Some cats need vitamin K, because if your cat is yellow or jaundiced during this fatty liver issue, this whole condition can interfere with vitamin K status. So sometimes they need vitamin K. These are antioxidants because the liver is very stressed. It creates free oxygen species. These are things that break down liver cells. It gets harder to heal in this condition when you've got a lot of free radicals out there, and these molecules that you feed your cat, these supplements, are all designed to give the precursors so they can relax a little bit when it comes to these reactive oxygen species. So they're antioxidants to help with healing. And they do work. Next one, it's called L-carnitine. This is an amino acid, and it can, in some cases, help cats with fatty liver disease. So there's a supplement you can get, very safe for cats. It's been used, it's been studied for them as well. Last but not least, check magnesium in the blood work. Why? Magnesium too low can hide your cat's true health potential. If you've got everything else going right, all your treatments and all the other treatments are in place, but your cat isn't doing as well, you can suspect or look for low magnesium. And if it's low, it's gonna artificially make them look crummy. So you can then supplement them at that point in time. So really, the foundation of fatty liver disease or hepatic lipidosis is get the diagnosis, aggressive nutritional therapy, the right antioxidants, control nausea, make sure hydration is good. These are the vitamins, the antioxidants, and making sure magnesium isn't too low. Your cat has a chance. Pew pew energy coming right at you. Best of luck. Let us know how things go. So, how does one even sum up the topic of liver disease in cats? Because in some cats, it can look so different than in others. First, don't panic. Find out if the liver enzymes in the blood is just the smoke alarm versus the actual fire. If it's the smoke alarm, find out what's the underlying cause, and then you address that. If the liver is the actual business, if it's the fire, that's when you go down that chart. You look at things logically, you take each step at a time. You make decisions based on, is this next step I'm going to take going to lead me to a treatment that I'm willing to do, and will it benefit my cat? We've talked about hepatic lipidosis, which is a very common type of liver inflammation a lot of your cats could be facing. And at the end of the day, it's really the first step that matters the most, which is don't give up.